When the skin that showcases not only health but also beauty, personality, and age is affected by chronic skin disease, there is a multifold impact on the mental and physical health of the patient. Autoimmune skin diseases like psoriasis, eczema, vitiligo, scleroderma, lichen planus, etc., infections, allergies, keloids, cancer are among the many skin diseases. Symptoms can vary from pain, warmth, burning, loss of sensation of touch and pain, change in color to red, black, white, blue, inflammation, bumps, sores, etc. Often the symptoms of an internal disease may appear on the skin. Sometimes the symptoms on the skin can be that of a disease of blood vessels, joints, kidney, liver, heart, respiratory system, or other organs. What is the cause of chronic disease like psoriasis, eczema, vitiligo, etc.? In spite of all the latest developments in modern medicine, why is it not possible to cure these diseases? How is it possible to overcome such diseases? What should patients of such disease take special note of? Health tips are not the focus here. Rather, the effort is on providing information that will help to understand the causative factors behind the health condition, measures for early detection, tests to assess the current status of the disease condition, present treatment options in modern medicine with the benefits and limitations. Also, I will try to convey the fundamental relationship of this health condition with the lifestyle and impact of correction of lifestyle has on reversing and preventing recurrence of this health condition. This is why the video may appear long. To help you save time, we have time-stamped the topics in the description below for those who prefer it. Here the focus is on those who would like to make more informed decisions on matters concerning their health. This is important, especially when they would like to avoid surgery and chronic medication with the added effort from their part. It should be remembered that those who are on medication should reduce or stop medicine only under medical supervision. To understand more about skin disease, we should have a basic idea about the anatomy or the structure of the skin. The skin is basically called integumentary system. It includes skin and the appendages like hair follicle, sebaceous glands and sweat glands also. It has three layers. Basically, it has three main layers: the epidermis, the outermost part, dermis, and the hypodermis. It is actually it's the largest organ of the body. It comes around 12 to 15% of the body weight. Even though the surface area is 1.2 to 2 meters, actually the real surface area is much larger, or the communication of the skin to the exterior world is much more larger, because each hair follicle appears like a well. So it has sides and it is also exposed to the atmosphere, and also this sebaceous glands, sweat glands also come. So the total absorptive area or the communicating with the outside area is much larger than what we are seeing also. The outer external part of the skin is called the epidermis, and it contains the nerve endings, nail, hair, and opening of the sweat glands and sebaceous glands, etc. And below that is the dermis, that is mainly made of connective tissue, blood vessels, the sweat and sebaceous glands itself, and the hair follicle, the hair root, the sensory nerve endings, and the muscle tissue of this pilosebaceous unit is there. So when the cold comes with the hair follicle is standing up, no? In that needs a certain muscle is there, that also included in that. Next is the hypodermis. Hypodermis contains the major part is the fat adipose tissue also is there. That is the fat storage of the, as some fat is stored in the skin. That is the skin, it gives the shape to the body and cushioning effect and protection and insulation and so many functions for that also. Next, when we consider the skin, there are so many microbes living on our skin. In this hair and hair follicle and sebaceous glands and all, there are so many microbes. When there is more hair, more microbes. So it is a better protected area for them to survive actually. There are around 1,000 species of different microbial organisms living in our hair. And that also very important for our health and defense and other activities also. The immune system functioning is dependent on these microbes also. Next, we should know what are the functions of the skin. Basically, skin is a part of the immune system, which is it forms a protective wall surrounding the body, and actually it is the boundary from the exterior, the air and the body is the skin actually the boundary forming apart. It protects from the ultraviolet rays, from the sun rays it is protect us, and also it is water resistant and it prevent water to ooze out from the body. When a skin disease comes, we see that there is, if it is an abrasion, the water start oozing out, or water or serum or water, the liquid inside our body is ooze out from the damaged part. Then it is actually giving the body the shape and the appearance, the beauty, everything depends on the skin actually. Next, it is the sensory organ, the most important sensory organ, one of the most important, that is also protective, that all the senses of our body is protective. It gives pain, touch, pressure, all are having an immunological function also for all the senses actually. They are cautioning our system to protect our system actually. The sweat is actually, it is promoting excretion of the waste products also. Just like sweat glands is protecting, having an important role in temperature regulation, it is excretion also. The skin is an excretory organ also. And next, it is an endocrine organ. It is actually the vitamin D. It's a hormone-like thing actually. It's a vitamin. Even though it is vitamin, it acts as a hormone in the body because it has transformed into another form and acts as a hormone and a growth factor and all. And this is actually made of the skin. And also this female hormone estrogen, that is also made in the skin. There are other raw materials coming from the adrenal gland and it is converted into estrogen by the subcutaneous fat actually. Then it's a storage space for the energy, that is in the form of fat. And many water-soluble vitamins also stored in this fat. Next, skin is an absorptive organ also. Just like lung absorb the oxygen, skin can also absorb some amount of oxygen directly. The outer layer of the skin actually doesn't get any blood circulation. It is actually from the deeper layer, from this the body fluids, it is getting the nutrients. So either from the atmosphere also the skin can absorb some oxygen, and also anything we apply on the skin, especially in a with the fat soluble things. That is why we are putting ointments on the skin to medicines to get absorbed. We are putting ointments. So just like intestine, it has also can absorb the nutrients also. Next, when we come into the disease part, what are the diseases which affect the skin? There are skin diseases that is only manifest only on the skin, and also other diseases, systemic disease which manifest on the skin. The most common is the infections we know. Bacterial infections can come, fungal infections can come, yeast and virus infections. When the most very common is chickenpox. The chickenpox is a systemic disease, but it is manifestation on the skin also. Then metabolic disorders like diabetes. Diabetes actually, the pre-diabetic stage itself, there is skin manifestation. In the type 2 diabetes, the hyperinsulinemia is the problem, actually insulin resistance. And the sign of hyperinsulin, which happens in the pre-diabetic stage, it's acanthosis nigricans. You get the darkening of the skin around the neck, axilla and the private thigh area and all, many parts, or even the face and all, darkening comes. So that is actually it's all for the metabolic disorders also, it is represented on the skin. And in the late stage of diabetes also, the dermopathy, that dark patches and all appear on the skin. And finally the foot ulcers, it comes. And when the foot ulcers, it is non-healing and infection sets in, we may have to even do the amputation also. Next, other metabolic diseases like dyslipidemia and cholesterol. When the cholesterol is high, you get deposits around the thinner skin, like around the eyes. Xanthelasma can occur. Next is peripheral vascular disease, because if there is atherosclerosis in the leg arteries and all, the skin get dark, the distal part, especially the foot and all, get darkened. And for this uric acid trophies can, deposit of uric acid crystals can create some swellings like a called trophy actually. That is another manifestation of systemic disease on the skin. And liver disease, this darkening of the skin is very common. Actually, you want only when the end stage of the disease, the liver disease and the kidney disease manifest with the discomforts. But if the skin changes occurs, especially the facial darkening, the cheek or the forehead and all is darkening occurs, you should definitely check for the skin, kidney and liver function also. Next is directly on the skin is allergies. Allergic disorders, rashes, wheal. While you are taking any medication, if you are getting darkening or the itching or rashes on the skin, you should be very careful, because if you ignore that symptoms, if you continue to take the medicine, you can get into a severe form of allergic reaction. It is a delayed autoimmune reaction sort of thing called Stevens-Johnson syndrome, in which your skin is totally peel off the skin, and even the mucous membrane and the eyes can be affected, or all the organs can, all the mucous membrane and skin can be affected. That is very difficult to treat also. So if you are on a medicine and if you get an allergic symptom, rashes, itching, etc., you should immediately contact your doctor. Next is autoimmune disease. Actually, it is chronic diseases like psoriasis, eczema, lichen planus, SLE, lupus disease, scleroderma, rheumatism, and pigmentation disorders like vitiligo. This all comes under autoimmune disease. In autoimmune disease, what is happening is actually our own immune system cells, this white blood cells and all, is attacking our own skin. That is what is happening in autoimmune disease. Next is hypertrophy. Actually, in generally there are tumors. We call it either it is cancerous or it is a hypertrophy, benign tumors. Actually, keloids are a type of benign tumors of the skin. It is fiber tissues are actually overgrowing. In cancer, there is a chance of spread also to distant places and the local and all. Keloids are more common in darker skinned people, especially in African origin. But in India also, especially in our Kerala part also, the keloids are increasing. Previously, when I was a student and all, the keloid we see in after skin prick, this ear prick for the ear stud and earring and all to put. But nowadays we are seeing many patients who is having even without a surgery and all, just a minimal abrasion and all, or without anything, this keloid, especially in front of the chest and all, the hypertrophic skin lesions are coming. Next, when we consider the skin diseases, the diseases of the nail and the diseases of the hair also is a part of the, it's a part of the integumentary system. So that is also, it's attached to the skin, sweat glands. The disease can occur in the sweat glands, sebaceous glands, hair, nail, etc. That also is a part of the this. In a broader sense, it is also a part of the skin disease. Next, about the treatment of the skin diseases. When we come to the treatment, it is infections. Like if it is a viral infection, we can use antivirals and antifungal, or antibiotics for the bacterial infection. That is simple. If once occurs and if it is treated, it may go, if the immune system is okay. If you are an immunosuppressant or other lifestyle diseases like diabetes, these infections can recur, come again and again. That is because your immune system is under stress, so repeated infections can come. When it comes to allergy or autoimmune disease, that is the major, it's a big group of disease of the skin. In that, what we are using is anti-allergic or anti-immunosuppressants. For the autoimmune disease, mainly immunosuppressants we are using. And for the psoriasis, eczema, scleroderma, lichen planus and all, many strong immunosuppressants has to be used. And in psoriasis, we are using even anti-cancer medicine like methotrexate we are using. The problem is that even though we use all these strong medicines also, it's only for a symptomatic relief. We are not able to get a cure. Only suppress the symptoms like itching, scaling and all, we can suppress. But after sometimes these medicines may be resistant. So you have to go more and more stronger immunosuppressants. And many patients may need, even for the allergic patients, may need the latest mode of medications like immunomodulators, like monoclonal antibodies and all is needed. And even with that, the disease may not be, the patient may not be in a comfortable stage in many circumstances. The symptoms may be continuing like that. When we consider skin and skin diseases, the cosmetics also should be considered. We are applying so many cosmetic preparations for the hair, for the lips, for the skin and all. So what is the impact on them on the skin disease also is very important. So we are using hair dyes and this keratin treatment for the straightening of hair and all. See, they are all getting absorbed because the skin, whatever is applied on the skin or the hair, it will go deep into the well of the hair follicle, and the hair follicle is the most important or a part of the body where it gets a maximum supply of blood. So when it reaches, when this seep into the well of the hair follicle, hair side and hair follicle, it will get absorbed. So for this, all the hair dyes and all, you can read the number of chemicals which is used in that paraben, and so many things are of carcinogenic in nature. Even this straightening, hair straightening used mainly having this curly hair, or those who want having a curly hair wants to get a straight hair, and the hairs, those who have the straight hair may want a curly hair also. So for both we are using the keratin treatment and using the heat, it is fixed, and the shaping the hair and all is done. So along with that, this keratin is a protein, but it is of animal protein which is used on this thing. But along with that, there are so many chemicals, especially the formaldehyde. It's a carcinogen, it is not carcinogen. And formaldehyde is used, and it is especially in ladies who are the one who is using more of the others are gents also using, but the ladies are more into this hair straightening and hair treatment and all, and the hair coloring and all. So the major risk is the cancer possibility. As for the ladies, it is the uterine cancer, breast cancer, and the ovarian cancer risk will be high, and also the bladder cancer, especially this chemicals applying, it is absorbed into the system, and it comes to the kidney and bladder, kidney failure and bladder disease. So that is anyone who is using these cosmetics should be very careful about it, and they should at least know the consequences. You are adding your beauty and all, but actually you are compromising your health while you are using any of these materials. And nowadays, because the formaldehyde is a carcinogen, there is many of the preparations should not. That is, there is a ban in many countries about the use of formaldehyde in this hair treatment preparations and all. But instead of that, they are used glycolic acid. Actually, there is a latest medical publication is showing a patient who's gone to renal failure after this hair treatment with this glycolic acid preparation. So even though it may not, we don't know whether what is the possibility of cancer possibility with the glycolic acid, but definitely there is a risk for burns, skin burns. That patient got scalp burns and also skin after 2 or 3 weeks. After that, she got a renal failure also. So we should understand that anything applied on the skin is this hair, especially the hair treatments. The hair is painless, so you do all sort of management on the hair. So, but it can harm your body. And also the other body care preparations. When we come to the body care preparations like hair care and this moisturizing agents and all, the major part of it is mineral oil actually. Actually, for the baby oil, previously we are using only edible oils like a coconut oil, olive oil and all for the skin care and hair care. But now our tendency is to more modern and more very fresh smell and all. We are using even for the children. We are using this baby oils and all is mainly of mineral oil. But the companies are using it because it is cheap and also it don't get damaged. When it's coconut oil, it is it will get damaged. The shelf life is very limited. So definitely this cosmetic or the mineral, this hair oil and body preparations like moisturizers and all, they're definitely easier to make it and extend the shelf life using the mineral oil. So we should understand that it is also has carcinogenic effects on this with this continuous use of the mineral oil. And also when the child is, we are applying all these things on the children's body and all, they lick it, this fingers and the skin, and this mineral oil get into the system, and it will even prevent the absorption of the vitamins, especially fat soluble vitamins like A, D, K and all will be hampered also because of this oil, mineral oil use for the skin application. Next, what is the solution? We have seen that there is so many medicines are there, but you are not getting a cure. Even you are not even getting a symptomatic relief with multiple medicines in many cases. Then what is the solution? First is early diagnosis. If you diagnose it early, especially this vitiligo, it is late stage, it will be very difficult to bring back the color and all. But if you diagnose it early and treat it, it is maybe easier for you to bring back the color and all. But all the medications used for vitiligo or whatever thing, vitiligo, it is actually you are stimulating, you are putting under the ultraviolet rays, under the we know ultraviolet rays can increase the cancer possibility. So actually, while treating to correct the vitiligo, you are actually inviting cancer also in another way. So what is the basic reason for this vitiligo? It is actually there is an autoimmune process. What is the reason for the autoimmune process? Not only for the vitiligo, the psoriasis, eczema, and all is an autoimmune process actually. What is the reason for this autoimmune? Our immune system is working against our own cell or the skin is because it's a lifestyle disease basically. So basically there is a deficiency of the nutrition or excess toxin in your body, and even this immune system is controlled by omega-3 and 6 fat. We all know that omega-3 is good for any skin disease or any disease. We take omega-3 supplements. But along with that, our diet, in the modern day diet, the omega-6 is very high. Actually, omega-3-6 balance should be in 1:1 ratio. But in our present day diet, omega-3 is almost nil and omega-6 so high. And that was because most of the cooking oils and the nuts, cashew nut, badam, pista, peanut, everything is having a very high concentration of omega-6, and that is inflammatory. That is actually controlling the inflammation part, defense part of the immune system, and the healing part, that is the repair. If the damage is happened, the repair is controlled by the omega-3. Our body is so deficient in omega-3, or our diet is so deficient, so the body is deficient. That is the reason for this increase in this all these sort of lifestyle diseases actually. So to get out of this skin diseases or whatever diseases of inflammatory nature, all the skin diseases are inflammatory nature. All the lifestyle diseases, diabetes, hypertension, heart disease, everything is of inflammatory nature. So to get out of that, we had to balance our omega-3-6 balance in our body, and also our major problem nowadays is the obesity, overweight and obesity. Obesity, overweight means your fat is accumulating in your body and your muscles and bones are getting weaker because of the lack of exercise. So that has to be corrected. The omega-3-6 ratio and the lean mass fat mass ratio to be corrected with the corrected diet and exercise. And also in the autoimmune disease, there is many of the food, the regular food which we are taking, maybe the patient may not be able to tolerate that. So if the patient is having multiple diseases and especially long-term this sort of chronic diseases, then they need some clinical support to find out which is good for their body, what is the problem, why this immune system is derailed. And in that, the clinically, actually, I am giving clinically supported lifestyle correction. And in the clinically supported lifestyle correction, actually, we are correcting the body composition at the macro level and micro level. And it gives comfort for not only for the skin disease, but along with that, if there is a hypertension or metabolic disorders like diabetes, hypertension, and all also get corrected along with that. In brief, 1. Our skin is the wall that protects the body from the outside. If opening develops in this protective wall, pathogens and toxins will enter. Additionally, there will be loss of water and nutrients from the body. 2. Like the kidney and liver, the skin is an excretory organ. The skin attempts to expel many toxins that the kidney and liver are not able to excrete. That is, if the kidney or liver are in trouble, the skin can help in excretion of waste. 3. If the liver and kidney fails to excrete toxins, they can reach the skin and cause discoloration, irritation, etc. This is why when there is skin discoloration or irritation, etc., it is necessary to check the kidneys and liver. 4. The presence of internal disease can manifest as skin discoloration, irritation, sores, etc. Autoimmune diseases like SLE, allergies to foods, medicine allergies, diabetes, cholesterol, cancer, etc. can create symptoms like discoloration, inflammation, irritation, etc. on skin. 5. When taking medicines, if skin itching or discoloration occurs, immediately consult a doctor to rule out medicine allergy. If such symptoms are ignored and medicines continued, it can even result in Stevens-Johnson syndrome and the destruction of the skin and mucous membrane in the mouth, eyes, etc., kidney failure, liver failure, and such critical situations. 6. Chronic autoimmune disease like psoriasis, eczema, scleroderma, pemphigoid, etc. occur when the immune system's defense lose balance and become overactive. The accumulation of toxins in the body, nutritional imbalance, exposure to allergic or intolerant or inflammatory food, imbalance in the nature, quantum, and health of the microorganisms that inhabit our gastrointestinal system, skin, etc., can all contribute to such an immune status. 7. When skin diseases like psoriasis, etc., are not addressed properly, further complications from the autoimmune disease like arthritis, thyroiditis, nephritis, etc. can develop. 8. Most chronic skin diseases have a foundation in immune imbalance resulting from lifestyle-related issues. Diagnosing the lifestyle defects, correcting them, and optimizing immune status is essential to overcome such diseases. 9. Even those patients who are taking anti-allergic and immunosuppressants like steroids, cancer, antimetabolite medicines like methotrexate, and biological immunomodulators like infliximab, etc., also can regain skin health and come out of medication if the patient is willing to take the effort to find out and correct the lifestyle factors which lies at the root of their disease. This information should assist you to understand and prevent lifestyle diseases, to help detect them at the earliest when present, and correct the lifestyle to reverse them. Also, it can be understood why medication and surgery cannot reverse such disease conditions. It is not the lack of medication or surgery that create the disease in the first place. This is why it is essential to understand how suitable lifestyle changes can only reverse these diseases and, more importantly, prevent their recurrence. Before any invasive interventions or surgery, it is essential to understand the underlying cause of the disease. What purpose does the surgery serve? The on-table and post-operative risks associated with the surgery, associated possible negative impact on future quality of life. This has to be understood not only by the patient but also the associated stakeholders, who are usually those who need to support the patient and share the consequences as well. Very often, there is poor understanding on whether the surgery provides recovery or relief and whether the surgery prevents recurrence. Nowadays, health insurance is very common. This provides an opportunity to undergo surgeries without fear of any financial stress. This consumerist outlook guides many to be opportunistic and take advantage of the surgical options available primarily on the financial availability angle rather than on an overall picture. This is where the statistics that often provide us the huge percentage of unnecessary surgeries done on unknowing patients deserves maximum attention. Before every surgical intervention, the patient or guardian actually signs the document acknowledging the possibility of undesired consequences or even deaths from the intervention. This document of acceptance is to be read and understood before fixing a date for any surgical intervention. One should understand that any surgery is constrained by chronic lifestyle diseases, and if the advantage of reversing them with the lifestyle modulation before deciding on need for surgical intervention is considered carefully, it will be possible to avoid the need for a majority of surgical interventions. We need to be proactive in health and not wait for the disease conditions to reach a stage where we lose hope of the ability to actively reverse our health problems with self-motivated lifestyle correction. Otherwise, we will have to remain an outside observer in the effort to recover health. Very often, never getting a clue of what the numerous healthcare partners are actually doing for your health. Very often, the core of improving body composition, metabolism, and immunity are never possible when you remain an outside observer, and this is what I hope will be the game changer for those who want health over conventional patient care. Another important aspect is when someone is talking about healthcare and newer treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kottayam as 1981 batch and completed diploma and MD in obstetrics and gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine, surgery, and painless labor, I joined government service. Later, I resigned from government service and in 1997 started practicing as consultant at Lifecarecentre, Thevara, Kochi. I focus on lifestyle modulation with the clinical support, minimizing medication and surgical interventions for lifestyle diseases. The focus was on understanding the effects of modern pharmaceutical drugs, surgical interventions, and physiotherapy on immunity. Based on the knowledge on the functioning of the immune system, developed nutrient formulas and body conditioning protocol named Oxyflex for optimizing circulation, stabilizing neuronal, hormonal, and immune activities. Optimized nutrition along with the Oxyflex is the foundation of the cell activation protocol, a clinically supported and supervised lifestyle modulation method for optimizing health, delay aging process, prevention and reversal of lifestyle diseases like diabetes, hypertension, heart disease, allergy, asthma, cancer, autoimmune diseases like thyroiditis, arthritis, psoriasis, etc., thereby reducing the need for medication and surgical intervention. Next, let us understand what is clinically supported and supervised lifestyle correction. Step 1 in this approach is to understand body composition and fatty tissue status to help determine desired body composition. Step 2 is to conduct laboratory tests to evaluate the health status of the organs of the body like heart, liver, kidney, pancreas, etc. Status of the system like circulatory, immunity, endocrine, metabolic, etc. and the compatibility status of food consumed or generally available. Step 3 is to identify what lifestyle modulations can help achieve the desired body composition. Patient-specific conditions will help decide on the effort at optimizing nutrition, physical activity, and the prevention of toxin accumulation. The focus is to create an enabling environment for the cells of the body to regain and retain optimum metabolic activities. When lifestyle modulations restores and retain optimized circulation, metabolic activities, hormone balance, immunity, and body composition, most lifestyle disorders can be overcome. When those who have been on medication for a long time and who have not reached the stage of irreversible organ failure are ready to modulate lifestyle to benefit from nutrition and help the repair and replacement of sick cells, protection from exposure to toxins, improved circulation through controlled physical activity, it is possible to prevent or overcome the vast majority of lifestyle diseases like diabetes, hypertension, angina, cardiovascular disease, allergies, asthma, arthritis, autoimmune diseases, cancer, etc. This also helps to avoid the need for medication and surgeries. Next, what is the benefit for patients who are suffering from chronic skin diseases like psoriasis and all with this clinically supported lifestyle correction? I'll give an example. I'll explain about one patient who's she's a lady, 51-year-old lady. Her height is 150 centimeters and weight is 60 kg. She is suffering from psoriasis for the last 22 years. She had thyroid problem and for that he had done a surgery 2 years back. And she is having severe migraine that also there for the last 22 years. And she is having gastric problems. Yeah, for that actually he had gone for a endoscopy and showed antral gastritis. And she was diagnosed with achalasia cardia of type 2. But she has tried many mode of treatments. Modern medicine is there. She has consulted multiple skin specialists, and also we have this our indigenous system, Ayurveda. She has tried, and also homeo, and many. She has tried all methods actually, and her problem is she is having severe itching. Actually, the disturbing is the severe itching. The whole body is affected, whole part is affected actually. Even there is pustular lesions. Usually it is rare with it's mainly scaling we used to see. She is having pustular lesions also on the skin. And she is pre-diabetes and also her GFR is also slightly decreased. And the cholesterol, triglycerides and all is dyslipidemia is also there. But she has, before she is coming to me, actually she has stopped all the medicines actually. And the 8th day, after starting this clinically supported lifestyle correction, this special food is there to ensure that all the nutrition is there. Actually, she is almost 10-15 kg overweight. This excess fat in her body also has to be corrected. So she is given a low calorie diet, but all the nutrition, ensuring all the nutrition is there in her food. And also the special skin application, which also contains, it's a skin nutrient actually, based on omega-3, 6 and 9 and fat soluble vitamins. So it is applied over the skin, and till actually for this skin lesions, when the severe symptoms are there, every 2 or 3 hours they can apply the oil, because it doesn't have any, cannot produce any side effect. It's only nutrient actually. So once it is settled, they can reduce the number to twice or once a day. When the skin is totally clear, then it can be reduced once or twice a day. So that is the thing actually. Nutrition either on the skin, applying on the skin, or as a body care, and also food taking inside, and also the mild exercise pattern, which is actually stimulating all the cells in the body, and so that the excess fat is burned out, and also the whole part of the body is getting even the skin is get stimulated, and the all this immune system is actually we are trying to correct his immune system and the body composition. And within the 8th day when she came itself, she was comfortable, she was able to comfortable sleep and all. And by 30th day, almost the skin itching is completely gone, and the skin is getting corrected. By 90 days, she's almost cleared of the disease actually, and no medicines, and her dyslipidemia and the renal functions came back to normal. Prediabetes, HbA1c came down to 5.5. All the blood parameters, because we are test all the initially itself we test all the systems, what is the health of the system with the blood testing and all. And she is able to, by 90 days, she is able to reduce her weight from 60 to 50 kg also. And when she came, actually she is only 51 years, but her body age was showing 60 actually. And the body age also came down to, by 90 days, to 50. Actually she's becoming 1 year younger. Previously she was 9 year older. So the body is getting corrected. The immune system is getting corrected. That is why she's getting the skin and also cleared, and the symptomatic relief is there. One more patient, she's also a lady, and 151 centimeters height, 64 years old, and weight is 57.7. And she is having diabetes for the last 12 years, and she is on medication for diabetes, and varicose vein for the last 38 years, and allergy and itching is there, and her whole body, including the skin around the eyes, nose, everything, every part is actually, the skin is damaged. The thickening and the psoriatic appearance is mainly in the buttocks and the back and all, which is severe. The skin problem is there. And in the leg, actually, she is having sort of eczematous lesions with oozing and all is there. Not much, but that is abrasions and all with itching and all is there. And she is having varicose veins also. And her symptoms actually is multiple symptoms. Knee pain, leg pain, sneezing, cough, skin, and she is not able to sleep because of the itching. Actually, by the 8th day itself, the symptoms has come down and she is able to sleep properly, but itching is not gone completely, but it is reduced. If it is initially it is 5 plus, she is saying that it is 3 plus by 8th day itself. By 60th day, her symptoms is almost gone, but the thickening and scaling is persisting because it is a whole body is affected. So, and her weight also has come down to 57.32. She reached by 60 days, she has reached to 53, but weight reduction is comparatively low. And also by 90 days, she came down to 50. So ideally she should come down to around 40 to 45 kg. Actually that is the ideal. By the time she will reach, the skin also become, but now by 60 days itself, 30 days itself she is comfortable. And about that, actually I forgot to mention that actually she is diabetic, and her HbA1c was initially on medicine, which was 8.2, and the next day itself actually her sugar is under control without medicine. When we start this clinically supported lifestyle correction with a low calorie diet and all, we stop the diabetic medicines initially, the first day itself. Without medicine, actually her HbA1c came down from 8.2 to 7.7 in the 8th day, and by 30 days it came down to 6.8, and by day 30 it has come down to 6.2. So it is also, everything is coming down. without medicine. All the diabetic medicines and other medications she was using mainly for the diabetes, and that is all stopped. And almost she is comfortable, but she needs some more correction, and she may need at least 180 days, 6 months follow-up is needed. Another 3 months also is needed. Another patient is a boy actually. It's only 15 years. His height is 174 centimeters and weight is 52.2. And his problem is vitiligo. And he was diagnosed with vitiligo for the last 1.5 years, and he's on medication. And actually he's taking one medicine, oral medicine, and trio 25 milligram 6 a.m. and he sits under the sun for this this poor therapy sort of thing, actually, that is sun rays application, and applying some lotion on the skin also. That is actually making the skin more sensitive to the ultraviolet rays. So his problem is actually the disease, that coloring and all is come down, but it is not gone. And the lesion is there, but it is faded actually. Almost not all normal, but it's not purely white, but reduced in the color. Appearance is improved, and the size also reduced. But the problem is he is getting darker. He was a fairer boy, and he's getting dark skin. And also other problems is he's having gastric issues. Intestinal problems is the sneezing. This allergic this thing is there, and also he's having pimples, and even he's finding it difficult to sit because he's having pimples at the buttocks also, not on the face alone. So that are multiple problems is there, not only this actually. With after starting clinically supported this food and all, even though he's this teenager, he's following everything correctly, and the immediate symptoms actually is sneezing, and this gastric problem or come down. With the 8th day itself, his symptoms has come down. He had, when we looked into, he had some inflammatory markers was slightly high, and the vitamin D was low, and some toxic elements like tin was there. So that for that also, how to we are basically giving exercises and all. And by 30th, actually by 30th day, he doesn't have any symptoms of this gastric symptoms or allergic symptoms. Everything has gone. And the skin color also, by the time he is initially, actually we didn't stop even the first day itself. Actually, when her 8th day itself, his symptoms have started improving, and we stopped the medication. Actually, that is reduced to half. And then by 15th day, he was asked to stop the medicine for this ultraviolet ray sensitizer. But he is continuing with the sun treatment after applying this nutritional oil on his body. And then with the nutritional oil, he is exposed to sun. So this nutritional oil is actually, it is a protection from, act as a thin layer on the body, and it gives us a sunscreen itself. But it will help to absorb the sun's energy, and so the vitamin D. Even you should remember that even if he is taking all this sun rays after this medication, his vitamin D level was low. But in this, we are actually, sun rays is taking, and his vitamin D level is we are given supplements also, and it has come down to 64. It's normal within 30 days itself, and then his that supplement is not needed. And within when last I see, so it's 90, after the 90-day visit, he's completely okay with this. There's no sign of any vitiligo also is there. But this fast reduction is able to come is because it is in the initial stage. That melanocyte was not completely destroyed in that part itself. If the extensive lesion, and if the this color is totally gone, it may take more time. And sometimes if it is established lesion, it may not be that part, it may not come also. That depends on how perseverant and how much effort the patient is taking. And even if the patient is taking, if it is there is no total vitiligo, total pigmentation is lost, or the cells are lost for 4 or 5 or years more than that, we may be able to prevent the future recurrence, future increase in the symptoms we'll be able to avoid, and also going into other autoimmune diseases. If one autoimmune disease comes, there is a possibility of getting other autoimmune diseases. Your immune system will be derailed. So that we can correct. But if the total loss of cells has happened, then we may not be able to revert that. One more patient. This is a 30-year-old man, 151 centimeters and weight 56 kg, and he is having skin disease for the last 15 years. And he has also tried many forms of treatment, and actually it was not a clear diagnosis, was also not, he's not bringing, usually the patients will come from biopsy reports and all, but he didn't do any biopsy or any clear diagnosis. So many treatments are taken, but no clear diagnosis. But in look-wise, it is a keloid actually. It is, he's having this chest, this above the, in front of the chest, that is sternal area, there is hypertrophic lesions, and also small lesion all over the body, especially upper part of the hand and the back and front, everywhere. Small keloid lesions. He doesn't have much, mild itching is there, but not much symptomatic. That is the difference between keloid and the psoriasis and eczema and all. The symptomatic discomfort and itching will be so much. But here, that much problem is not there. The keloid, if it comes on the over the joint and all, it will restrict the movements actually. But he didn't have any keloid lesions over the joints. Only this chest and this moving part, it is not much there. Actually, he is, when we looked into his allergy and intolerance test, he is allergic to so many things like fish, egg, milk, even the regular or staple diet like wheat and rice also he is allergic, and the vegetables like tomatoes and the pulses, many of the pulses, and so many things he is allergic also. In all this allergic or intolerant, actually we are checking the immune response to these food items also. If the body is reacting to this sort of food, it is not suitable for the person, it has to be avoided. So we are giving special food with all the nutrition, so it is easy to avoid that. It can add, and also he needs some weight reduction also. He is overweight for his height, and his fat percentage is almost 22% actually. At his age, with these problems, he should be, the fat percentage should come down to 10 to 15%. Actually, by 30, by his lesions are started coming down, but his fat weight reduction was initially that not that I was not that happy. But the third month, he is able to come down to 16.2 and also his weight came down to 51 kg. Actually, what we are expecting is to bring down his weight to at least to 45 kg and the fat level to 10%. Then build up his body with the muscle. That is what is needed ideally. But by the 90 days, all the small lesions are disappeared actually, completely gone. Only few lines actually, there is horizontal lines, parallel lines in the chest wall is there. That may come down slightly, but it may take some time. That hypertrophy also may fade away, but it is not completely gone by 30 days. But he needs also further follow-ups also for another, most probably by 180 days he will be, that also it not, I don't expect it is to disappear completely, but at least no lesions will not come, and it will some fading away of that major scar lesion, keloid part also. One more skin problem patient. Actually, she is having so many problems. She's a 37-year-old lady, 163 centimeters height and weight 68.2. And she had undergone a bypass surgery. She had 5 blocks. She has chest pain, and they looked into angiogram, showed 5 blocks, and undergone a bypass surgery 4 months back. And she is diagnosed with scleroderma 20 years back. 20 years. So for the last 20 years, she's a non-scleroderma patient. And varicose vein is there for the last 1 year. And currently her major problem is pain associated with an ulcer in the leg. Whether it is of varicose ulcer or a scleroderma, basically I think so that it is a scleroderma, and it is actually dipping in lesion, actually it's a concave lesion, and the pain was severe for her. And also she's taking so many medicines. Steroids was the CQ is there, Medrol 4 milligram is there, and for the heart she is taking Rosat, that is rosuvastatin 40 milligram, Silacar, that's antihypertensive, Cardiovas, Ecosprin, Coradron. So many medicines are there actually. Moxgalin, that is for the pain relief, she's given. Pregabalin tablets are there. And so many medicines also is there. Actually, in the clinically supported lifestyle correction, we are not looking into the skin alone. And her basic problem is scleroderma, and the scleroderma is an autoimmune disease actually. Because of the scleroderma only is bringing her this heart, her blood vessels, cardiac blood vessels are affected. And it was very thin blood vessels. Actually, it is shrinking. The blood vessels are shrinking because of the this autoimmune disease. Just like the skin is shrinking, the blood vessels are also shrinking. That's why she's not, the cardiologist or the interventional cardiologist is not able to put a stent. That's why she has undergone this bypass surgery. But even if she undergoes a bypass surgery, she's only 37. So the shrinking, if the autoimmune process is not blocked, this disease will continue. Even the blood vessels, not only the heart blood vessels, the other part of the body can also be got affected. And when we looked into, she is already diabetic also, because she is on steroids and all. She was not knowing that she is diabetic. But she was, when we started, she was taking 9 medicines actually. And the 8th day when she came, there was only 3 medicines. So we are, even the cardiac medicines, we can, even the BP will get to normal. Actually, with the medicine, her BP was high when we started. Actually, 130/84 was there. But on the second visit, her BP has come down to 114/85, and the BP medicines also, meantime, it was reduced. And the pain is reduced. By 30th day, there is ulcer. So pain is not completely gone, but she's comfortable, she's able to sleep. And by 90 days, there was no symptoms actually. Even this ulcer also healed completely. And her HbA1c came down to, by 30 days itself, 5.5. When we started, it was 6.8 actually. And the cholesterol, all the parameters, blood parameters, including the cardiac parameters, and came to normal. And when we started, actually her TSH, that is her the thyroid problem also is there. So TPO also is very high. But the TPO, that is the thyroid autoimmune antibodies, she is having this thyroiditis, Hashimoto thyroiditis also. But she was not known that or taking medicine. But when we checked, she is having GSH is high and autoimmune antibodies is high. But 90 days also her ATG level came down, but the TPO level didn't came down much. But the thyroid function and all is corrected. So it's an autoimmune disease, it's a progressive that patient has to follow. You should avoid the intolerant food, and take care. And her problem also, another problem was she's not able to bring down her weight as expected. By 90 days, she was expected to bring down her weight to 56 or so. But she was, by 90 days, she was reached only 64. That is a very low level. That is the reason this autoimmune antibody is also not coming. But with her, for her height and with her disease, especially this systemic autoimmune disease, that scleroderma, she has to bring down her weight to around 50 kg actually. So now she's not at bringing down. That is the problem actually. She has to pursue and bring down and then it maintain it. That is what is needed for this patient, because it is a much more, it's not just a skin disease, it's a much more deeper, all the systems can get affected. The focus of clinically supervised lifestyle modulation is not on the symptoms. Focus is on the lifestyle parameters to be corrected to set right the undesired variations in the body composition, hormone activity, circulation, immune status, etc., which are at the root of one or more lifestyle diseases. This explains why patient can simultaneously get relief from multiple diseases, multiple symptoms, and multiple discomforts. We should understand that the basis of recovery from diseases is the self-healing power of the immune system. The goal is to create the optimal environment for the immune system to stimulate this self-healing power. Everyone should try to self-modulate their lifestyle to optimize health. When this is not possible, or when suffering from a serious condition, or when suffering from multiple disorders, or taking chronic medication, or suffering from the ill effects of chronic medications, or when the surgery is under consideration, the need for clinically supported and supervised lifestyle modulation becomes necessary. We believe the informed patient is the key to treatment success. You can find detailed content on different diseases, the treatments with the emphasis on the benefits of lifestyle correction from the website and YouTube playlist. The videos are prepared to understand more about the disease, the possible underlying cause, early diagnosis by understanding the symptoms, current diagnostic methods, and treatments along with the benefits and side effects. Practical aspect of the lifestyle self-correction, and for those who may require clinically supported and supervised lifestyle correction. When a patient is having more than one disease and there are too many diagnostic and treatment modalities with many side effects, awareness of the benefits and problems of different diagnostic, medical and surgical interventions is the key to regain your health. Better informed patients take better decisions and live longer, healthier, happier lives. Thank you.